My name is Melissa Berry, and I'm the founder of cancerfashionista.com, and I live in Closter, New Jersey, and I have two daughters, Maya and Erica. I spend my free time with my daughters. They are teenagers, they're super busy, and actually we're all super busy. So, we really treasure our time together. So whether we're, going shopping or running into the city to do some sightseeing or even baking at home, I just really treasure that time with them. Let me just say that the worst thing to have to do is call your parents and tell them that you have breast cancer. And that was probably one of the most difficult days of my life. I knew I had this diagnosis. My husband at the time, I'm no longer married, but he has always been a wonderful supporter. He was in a meeting that I couldn't even reach him, and my father was only 20 minutes from the hospital. So I called him up, and I'm like, "Daddy, I have breast cancer." And I mean, it was horrible. My mom came home that day from work, and I get so choked up. She told me that she told me now that she said she couldn't cry because she felt like if she did, she would never stop. And she was so strong. So I remember when we had the diagnosis, we went into, it was like battle mode. My dad's like, "Let's call the doctor." I mean, by the next day, I had a consult with my breast surgeon. I had to really start thinking about what my approach was going to be with my cancer treatment first and foremost, and then my reconstruction. So I opted for implants. I wanted to, my goal was to just really look like myself. When I was going through treatment and I wanted to get really good information, I found that there were some really great resources. I love, because I had triple negative breast cancer, the Triple Negative Breast Cancer Foundation has a wonderful website as well as an online community, and I just adore them. And also Living Beyond Breast Cancer, again, wonderful website, but they have a community, and they also are able to pair you with women that have gone through similar treatment, they're a similar age group, have kids or don't, they pair you. And I thought that was just incredible. My biggest piece of advice really is to not look at your treatment as don't look at all of those treatments at once. It's a huge mountain and you'll overwhelm yourself. But if you kind of look at it in baby steps, okay, I have a consult tomorrow. Okay, in a week, I'm going to start chemo. I think you just need to really pace yourself and just be kind to yourself and know that you're going to have days that you're going to feel okay, and you're going to have days that you're going to need to really just rest and take a time out from your life, which is very hard to do, but unfortunately, that's what you need to do. And this is why it's so important for women to have an advocate, to have a family member or someone with them when they're going in for their initial consult, because you're really not able to absorb all the information. And I remember seeing the doctor talking and just drawing the breasts and the diagram, and these are the options for surgery, and here's the percentage of your life expectancy if you do this or that. And I'm thinking, oh my God, I was just a normal mom, doing PR 2 days ago, and now we're talking about my life expectancy. It's mind-blowing. It's horrible. But I'm so blessed to have an incredible family and incredible doctors, and I'm here today so happy that I'm on the other side and able to help other women that are going through this. It's life-changing.
Natrelle Breast Implants, important safety information and approved uses. Breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery. Breast implants have been associated with the development of a cancer of the immune system called breast implant-associated anaplastic large cell lymphoma, BIA-ALCL. This cancer occurs more commonly in patients with textured breast implants than smooth implants, although rates are not well defined. Some patients have died from BIA-ALCL. Patients receiving breast implants have reported a variety of systemic symptoms, such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. Individual patient risk for developing these symptoms has not been well established. Some patients report complete resolution of symptoms when the implants are removed without replacement. Who can get breast implants? Natrelle breast implants are approved for the following: breast augmentation for women at least 22 years old for silicone-filled implants, and for women at least 18 years old for saline-filled implants. Breast augmentation includes primary breast augmentation to increase the breast size and revision surgery to correct or improve the result of a primary breast augmentation. Breast reconstruction. This includes primary breast reconstruction to replace breast tissue that has been removed due to cancer or trauma, or that has failed to develop properly due to a severe breast abnormality. This also includes revision surgery to correct or improve the result of a primary breast reconstruction. Who should not get breast implants? Breast implant surgery should not be performed in women with active infection anywhere in their body, women with existing cancer or precancer of their breast who have not received adequate treatment for those conditions, women who are currently pregnant or nursing. What should I tell my doctor? Tell your doctor if you have any of the following conditions, as the risks of breast implant surgery may be higher: autoimmune diseases, example lupus and scleroderma; a weakened immune system, example taking medications to decrease the body's immune response; planned chemotherapy or radiation therapy following breast implant placement; conditions or medications that interfere with wound healing and blood clotting; reduced blood supply to breast tissue; clinical diagnosis of depression or other mental health disorders, including body dysmorphic disorder and eating disorders. Those with diagnosis of depression or other mental health disorders should wait for resolution or stabilization of these conditions prior to undergoing breast implantation surgery. What else should I consider? There is a boxed warning for breast implants. Please see bold text at beginning. Many changes to your breasts following implantation are irreversible. If you later choose to have your implants removed and not replaced, you may experience dimpling, puckering, wrinkling, or other cosmetic changes, which may be permanent. Breast implantation is likely not a one-time surgery. The longer implants are in place, the greater the potential risk for complications. You will likely need additional surgeries on your breasts due to complications or unacceptable cosmetic results. Thus, you should also consider the complication rates for later revision surgery, since you may experience these risks in the future. Cancer treatments and surgery will affect the outcome and timing of breast reconstruction. Breast implants may affect your ability to breastfeed, either by reducing or eliminating milk production. Rupture of a silicone-filled breast implant is most often silent. Even if you have no symptoms, you should have your first ultrasound or MRI at 5 to 6 years after your initial implant surgery, and then every 2 to 3 years thereafter, regardless of whether your implants are for augmentation or reconstruction. If you have symptoms of or uncertain ultrasound results for breast implant rupture, an MRI is recommended. Additional imaging may be required depending on your medical history and status. The health consequences of a ruptured silicone gel-filled breast implant have not been fully established. Routine screening mammography for breast cancer will be more difficult, and implants may rupture during the procedure. Perform self-examination every month for cancer screening and ask your surgeon to help you distinguish the implant from your breast tissue. Lumps, persistent pain, swelling, hardening, or changes in implant shape should be reported to your surgeon and possibly evaluated with imaging. What are key complications with breast implants? Key complications include reoperation, implant removal with or without replacement, implant rupture with silicone-filled implants, implant deflation with saline-filled implants, and capsular contracture, severe scar tissue around the implant. Other complications include breast pain, swelling, asymmetry, wrinkling, rippling, implant malposition, nipple complications, hypertrophic scarring, and implant palpability visibility. Talk to your doctor about other complications. For more information, see the patient brochures at www.allergan.com/products. To report a problem with Natrelle breast implants, please call Allergan at 1-800-624-4261. The sale and distribution of Natrelle breast implants is restricted to licensed physicians who provide information to patients about the risks and benefits of breast implant surgery.